group in Kentucky that wants a clinic like this, and the clinic that I'm working on in Belleville is really meant to be a model for how you set up a 501c3, organize a board, what are your bylaws, what's your principle of operation in terms of the financial structure, and also it was meant to recruit the community to support us. We're not grant supported, we're supported by the communities that we serve. And as I get toward the end of the talk, I'll show you a picture of a building we're working on, and that is really a community effort, as you'll see. I just like to show this. Crystal, who's holding that rabbit there, is now about 18 or 19 years old. Maple syrup urine disease, I just have to acknowledge how important that was for supporting what we do. It was a very difficult disease. When I was a fellow, about half the patients with that disease died of cerebral edema. Those that survived often were disabled, mentally and physically. Our oldest patient still is living, 1967. She's completely dependent. She's almost, well, she's 51 years old now. Her niece was asymptomatic as a newborn, and she was sent home from Ephrata Hospital in the low-risk early discharge group and came by the clinic, did a blood sample. We ran a blood sample. She had maple syrup urine disease. She was not sick. She went home. I made a couple house calls to monitor her levels. We got her started on therapy, and she's never been hospitalized. I live in Wisconsin now. I think she's, well, whatever those number of years are, early 90s, almost 30 years old now. And Angie DeGeorge, who was at St. Christopher's Hospital, DeGeorge syndrome, did some of the earliest work with the Mennonite population with MSUD, sent me a letter, and he said, I cannot imagine taking care of newborns at home with maple syrup urine disease. He said, I just don't know how you do it. Well, in 2002, we published a paper about the care of 36 newborns, and now it's about 80 newborns. And half of those are identified through carrier testing and identified with cord blood samples on the day of birth, and they're taken care of at home, they're never sick. And then half still come in through the newborn screening program, but the kids through the newborn screening program are always sick. By day 4 with that disease, they're pretty sick. But we've learned how to take care of them. This is just to give you a sense. Now, one time we were following about 120 children with maple syrup urine disease, one of the largest populations in the world, and this is a severe variant. In the early days, pre-1989, when I was still around the shop, the hospitalization rate, which all of you will appreciate, is about 7 days per patient per year. Think about following 120 patients with maple syrup urine disease and having 7 days per patient per year of hospital time. It's a lot of hospital time. This is what happened to the hospitalization rate, just as a consequence of better access to care and monitoring, and just a better understanding of how to manage the disease out of the hospital. The most recent numbers, 2015, 2016, about 0.1 day per patient per year of follow-up. And as many of you know, we now have started doing liver transplants. When we started in 1997, the first liver transplant was done for maple syrup urine disease. It's a curative procedure. We have now done 87 liver transplants electively for maple syrup urine disease. About 40 of those are from the Mennonite population. The others have come from Brazil and India and the Middle East, places where people have trouble getting health care. And all of those transplants are successful. And I mean that by that, when patients come out of the operating room, their MSUD is controlled. When they wake up, they want a hamburger or a piece of chocolate cake or a chicken nugget or whatever it is they've dreamed of eating, they may have it. It's an amazing thing to see.